Well, having a sick child is never easy for a parent, and the hospital is the last place any child wants to be. But many hospitals are making it easier for children to be treated thanks to alternative medicine. A new book looks at common and effective therapies being used with children, including acupuncture, massage, and aromatherapy. It is called Integrative Pediatrics. And joining us is the co-author, Dr. Timothy Culbert, who is the medical director of pediatric integrative medicine at Children's Hospitals of Minnesota. Thanks for being here this morning.
My pleasure.
Let's first start out talking about the story of Daniel Hauser, the local 13-year-old boy who made national headlines. He had, Hodgkin's lymphoma, and his parents refused chemotherapy. And is this prompted a lot of discussions? Are some parents now, because of his story, opting out of traditional medical care? What's happening since this story came out?
Well, a couple of interesting points to kind of frame that discussion. You know, years ago, back in 1999, actually, the Integrative Medicine program, which offers complementary and alternative therapies at Children's, was started because children's in oncology that had parents of kids with cancer wanted other options for their kids with cancer. So, by and large, I would say that complementary medicine in particular has been highly utilized by children with cancer. Some studies indicate that over 85% of kids with a diagnosis of cancer use some form of complementary medicine. And so this case, I think, just brought to light this idea that, by and large, I think right now the state of the art is that complementary therapies for kids with cancer are excellent in terms of adjunctive symptom control. So when kids have cancer and they get treatment, they commonly experience nausea, fatigue, insomnia, pain. And integrative therapies are excellent in terms of managing those kinds of symptoms. I don't believe that it would be considered state-of-the-art to treat the cancer itself with alternative therapies.
Just alternative, but this is combining maybe Eastern and Western medicine together, the Eastern medicine helping kind of combat the result of the Western medicine.
Exactly. So we think it's kind of the best of both worlds, that many of these kids certainly will still need their life-saving treatments like chemotherapy or radiation, but alternative therapy can make their quality of life so much better in mediating these symptoms that are very debilitating from cancer and its treatment.
And we should mention that Daniel Hauser, he was ordered by a court to undergo that chemotherapy. Now, describe the integrative medicine program at Children's. What makes the program so unique?
I think one of the unique aspects is that we are the largest, longest running program of its kind in North America, so we've really had more experience than anyone else in the United States with this kind of approach with kids. We've definitely always been very interested in evidence basis of what we do and safety, so that we do a lot of research as part of the program. We've looked into things like biofeedback for headaches, aromatherapy for sleep and nausea control, massage for kids with cancer. There's a lot of interesting research projects we've been doing. So we've tried to, I think, really balance the excellence in clinical care over time with also looking at how these things work and whether they work.
Okay, and what would you say are the most common ailments that seem to be showing the most promise with alternative therapies?
I think several things are really promising in terms of chronic illness in particular. If we look at things like chronic pain, children with chronic pain are doing very well with alternative therapies. Acupuncture, for example, people don't think about that for kids so much, but kids are actually very well accept needles. Not uncommonly, the needles are very tiny that are involved with acupuncture treatment. But also when they're not comfortable with that, we offer acupressure, for example. So we adapt developmentally a lot of these therapies for kids. Another good area is depression and anxiety. We're finding that more and more kids that don't want to go on medication for mental health disorders do really well with integrative therapies, particularly nutrition. Things like supplements and vitamins and herbals, but also things like meditation can be very helpful, and good evidence is coming out to really support that right now.
Okay, and quickly, can you explain how chiropractic care is helping children who are suffering from a variety of illnesses?
Sure. Chiropractic care has been used as a way to manually adjust the spine, if you will. And it's been particularly useful, I think, in terms of the evidence that's available for things like low back pain, headache. It's also been used more and more for prevention, for just keeping kids healthy and well over time. So I do think there are some reasonably good applications that can be considered. And other forms of manipulation as well, one called osteopathic manipulation, quite useful additionally.
When we first started talking about alternative therapy, it was primarily in adults, and now we see that it's being used a lot more widely in children. And the book, we should mention, is edited by Andrew Weil. Perhaps you have heard of his name before. All right, once again, thank you so much. The name of the book is Integrative Pediatrics, and it is available today. That's Dr. Timothy Culbert, Medical Director of Pediatric Integrative Medicine at Children's Hospitals in Minnesota. Thanks for joining us today.
My pleasure.